911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
In this video, we're going to talk about Pentosan polysulfate, what this medication is and how it might be helpful for you if you're dealing with arthritis of your knee, hip, shoulder, or some other joint in your body. My name's Dr. David Geyer, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Now, please understand, in this video, I'm not giving you medical advice. This is meant for general information and educational purposes only. Osteoarthritis is one of the most common afflictions that adults suffer. It affects over 32.5 million adults in this country, according to the CDC. When you broaden it to other forms of arthritis, like rheumatoid arthritis, over 22% of adults in this country have been told by a doctor they have arthritis. So it makes sense then that the surgery performed to treat osteoarthritis, joint replacements, those are becoming more and more common as well. In 2017, orthopedic surgeons performed about 1 million joint replacement surgeries that year. But by 2030, looking just at knee replacements, there's expected to be 3.5 million performed each year in this country. But that surgery, whether it's total hip replacement, total knee replacement, those surgeries aren't healing the damaged bone and cartilage. They're simply replacing the damage with metal and plastic. Now, the reason we've performed these surgeries for decades and that joint replacement specialists say it's the only option, it's based on the conventional theory for osteoarthritis and what that disease is. And it's just that, it's a disease. But the majority of doctors and orthopedic surgeons tell patients osteoarthritis is a wear and tear process that occurs after a major injury like a torn ACL, or over a long period of time in somebody that places heavy demands on their hips and knees, like runners, people who do manual labor jobs. That wear and tear process takes a toll on the articular cartilage in the hip or the knee, as well as the bone under it. The analogies doctors use so often is tread on a tire. The tread's the articular cartilage lining on the ends of the bones. When that articular cartilage, the tire tread, gets thinner and thinner, or even has spots where there's exposed bone, the thinking goes that you have to replace it with metal and plastic. Before patients get to the point of needing hip or knee replacements, we try other treatments. The mainstay of treatment for years has been cortisone shots into the knee. These injections don't fix the underlying problem, the worn out bone and cartilage, but they usually relieve pain. When the pain relief from one shot wears off, a few months later, you get another one. Pretty soon, you get less and less relief from each shot until you finally give up and get a knee or hip replacement. The problem with cortisone shots, in addition to not treating the actual damage in the knee and helping it heal, is there's a lot of scientific evidence now that cortisone does more damage to the knee, especially the more of them you get. It can speed the breakdown of the articular cartilage. Essentially, it might make you feel good, but it also might make the arthritis in your knee worse. Other injections used include viscosupplementation. Treatments like Synvis, Kylgan, Supartz, and others. They have some benefits in some studies, but some people aren't significantly better, and for some people, it doesn't help much at all. Some surgeons will offer to scope your knee or perform what's called a diagnostic arthroscopy and debridement. They go in and clean out the debris, smooth out the damage. But several studies over the last decade have shown that those surgeries might have limited benefit at best in the first few months after the procedure, but it's not helpful long term and it might actually be harmful. And again, all of these treatments for osteoarthritis lead to joint replacement. But now there's a treatment proposed that's suggested to be very beneficial for osteoarthritis, and it's called Pentosan polysulfate. So what is Pentosan polysulfate? Well, Pentosan's an FDA-approved medication used to relieve the symptoms like pain and discomfort of interstitial cystitis or inflammation of the bladder. It's been used for that purpose for decades. It's sold as an oral medication, a pill that you take by mouth, under the brand name Elmeron. But Pentosan's been used as a treatment for osteoarthritis in the veterinary world and by Australian physicians for many years. It's only recently received attention for that purpose here in the US. There are clinics here who use Pentosan as an off-label treatment for osteoarthritis, where patients inject it under the skin like patients with diabetes do with insulin. Here are some of the proposed mechanisms of actions that might make Pentosan effective for osteoarthritis. It's proposed to improve blood flow to the subchondral bone, the bone under the damaged articular cartilage. It's proposed to improve synthesis of the cartilage matrix, provide less or even no cartilage breakdown caused by inflammatory cytokines, and maintain the proteoglycan content in the articular cartilage. To see if this medication might be useful, let's start by looking at animal studies to see if Pentosan has any benefit for arthritis, and if so, why it might work. A 1999 review looking at research that studied Pentosan polysulfate for osteoarthritis using rats, rabbits, dogs, and other animals showed that Pentosan reduced joint swelling, reduced inflammatory markers in the joint fluid, led to better cartilage integrity, and improved proteoglycan synthesis. Based on this scientific literature, the researchers believe Pentosan polysulfate should be reclassified as a structure-modifying osteoarthritis drug. In a 2012 study, researchers created arthritis in 18 horses. 9 of the horses received Pentosan polysulfate, 9 served as controls. The horses that received Pentosan polysulfate were found to have significantly less articular cartilage fibrillation or cartilage breakdown. A 2019 study of rats with osteoarthritis looked at the expression of biomarkers and inflammatory mediators that we see in arthritic joints, like interleukin-1 beta and tumor necrosis factor alpha and many others. Not only did Pentosan lead to an improvement in symptoms of arthritis, it appeared to downregulate the expression of those harmful biomarkers and inflammatory mediators and cytokines. Now let's turn to evidence that we have in humans. Way back in 2005, scientists performed a randomized, double-blind, placebo-controlled study at a medical center in Australia. Over 100 patients age 18 and older with osteoarthritis of the knee were randomly assigned to receive Pentosan polysulfate as a weekly intramuscular injection for 4 weeks, or a placebo injection of Ringer solution to serve as controls. They found significant differences in duration of joint stiffness, pain at rest, and patient global assessment, basically how well they were doing overall, up to 5 months after the 4 weeks of injections. The Pentosan patients experienced less pain with walking and better overall function with activities of daily living. In a study published in 2010, 20 patients received weekly subcutaneous injections of Pentosan for 6 weeks. All 20 had reduced joint swelling. They also had improved knee flexion, less pain while walking, less pain climbing up and down stairs, and these clinical improvements continued for almost a year. A case study published in 2017 offers insight into how Pentosan polysulfate might actually work in human patients with arthritis. A 70-year-old woman underwent a trial of Pentosan injected into her muscle twice a week for 3 weeks. Her pain dropped from an 8 out of 10 to a 0 out of 10. But an MRI taken 2 weeks after the treatment showed that the bone marrow edema in the femur and tibia of her knee that she had before treatment, seen on MRI, was completely resolved. In a 2019 study in the journal PLOS ONE, researchers determined that Pentosan suppresses the release of nerve growth factor in the subchondral bone, which likely helps to decrease pain in patients with knee arthritis. Now, anecdotally, Australian researchers say that among pro athletes using Pentosan, they report experiencing significantly lower levels of pain while maintaining high levels of activity. Now, earlier I talked about how physicians who prescribe Pentosan polysulfate for patients with osteoarthritis do so by using it as an off-label treatment. That means it's not currently approved by the FDA for osteoarthritis, at least in the United States. But a clinical trial of Pentosan polysulfate just started with the NIH, which could be a major step to having it approved by the FDA as a treatment for osteoarthritis. Researchers at Northwestern and Australian researchers are doing a triple-blinded, placebo-controlled trial involving almost 1,000 patients with osteoarthritis, with the treatment group getting twice-a-week subcutaneous injections of Pentosan polysulfate, the control group getting saline injections. They will follow the participants for about 18 months to see if Pentosan polysulfate has a significant benefit for osteoarthritis. Now, are there any side effects? Well, Pentosan is a blood thinner, so you want to avoid it if you're taking other blood thinners like Coumadin for a heart condition or some other medical problem. You also might want to eliminate using anti-inflammatory medications like Advil or Aleve for the same reason. And maybe, since it is a blood thinner, maybe don't take it when you're about to undergo surgery. Now, with Elmiron, or the oral Pentosan polysulfate, side effects like diarrhea, hair loss, nausea, headaches, stomach upset, and abdominal pain have been reported. There are also reports that extended use of Elmiron might cause an increased risk of developing pigmentary maculopathy, which is a fancy way of saying it's a type of eye damage. These side effects have not been reported subcutaneously injected Pentosan polysulfate. Now again, there aren't many clinics in the US where physicians and surgeons are using Pentosan for osteoarthritis, but generally it's given as a subcutaneous injection right under your skin, usually in your abdomen, twice a week for 6 weeks, but some people advocate using it for longer. Again, please understand, I am not giving you medical advice in this video. This is meant for general information and educational purposes only. So what does all this mean? From the research that's out there right now, what's currently available, I believe Pentosan polysulfate does show promise. It appears to improve or maybe resolve the lesions in the subchondral bone, the layer of bone just below the cartilage and joints, which is at the root of the osteoarthritis problem. But we need much more research, especially the results of that randomized, placebo-controlled, blinded study currently underway, to really establish if it's effective for treating osteoarthritis. But if you're battling hip or knee arthritis or arthritis in some other joint, you could at least discuss it with your doctor. If you'd like to read the studies I mentioned in this video, I've provided links in the description below. If you like videos like this one, with information about optimal health and wellness, healing and recovery from orthopedic injuries so you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel. Click the bell to be notified of new videos and live streams here anytime. And if you have an orthopedic injury, a bone or joint injury, maybe you have arthritis and you want to see somebody who truly knows about bone and joint injuries in athletes and active people, I'd be happy to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I'd love to talk to you about all your options to recover from injury, not just surgery, cortisone shots, and physical therapy. Go to my website, drdavidgeyer.com, go to the contact page, and you can find out how to make an appointment to see me. The link to my website and the contact information is in the description below this video. My name's Dr. David Geyer. Thank you so much for watching. I look forward to helping you feel and perform better than ever.